My name is Kelsey Lee. I am a graduate nursing student at the University of Texas at Arlington. This is my comprehensive strategic and marketing plan for a women's plastic surgery unit at HCA Houston Healthcare Northwest. The facility in which this service will be provided is at HCA Houston Healthcare Northwest. This hospital is just one of HCA's hospitals in the greater Houston area that has been serving the community for over 45 years. The hospital offers multiple services as seen here. It is also designated as a Level 2 trauma center, Level 3 NICU, accredited chest pain center, and certified as an advanced comprehensive stroke center. HCA Northwest is located in Harris County, Texas, which is the largest county in Texas with an estimated population of 4.9 million people. This area of Texas is expected to continue to grow, and respectively, so will the hospital and their patient population. My proposal for the board is the opening of a women's plastic surgery unit, as plastic surgery continues to be a popular elective procedure across the United States. In 2023, liposuction was the most conducted procedure among women, followed by breast augmentation. As evident by this information, HCA has seen the great opportunity for growth to provide these services for the surrounding community. Above all else, we are committed to the care and improvement of human life is HCA's mission statement. HCA places a large value on recognizing the unique worth of each individual. By doing so, they allow for the patient to remain the focus of all their decisions. They also emphasize exceptional care as well as compassion and respect for patients and each other. Following is the patient care delivery model that shows just that, starting with the largest component being the environment or the community, followed by the organization, which is HCA Houston Healthcare Northwest, then the care team, which includes doctors, nurses, and other healthcare professionals, or anybody else that is a part of the health and wellness of the patient. And lastly, the patient, which is the center amongst all the other components. We will now summarize the strategic plan for the development of this unit. First, a plan in which renovation of existing patient rooms will be completed to accommodate these plastic surgery patients. Currently, this facility has an overflow unit that is only utilized during high census times, and this occurs only several times a year, leaving these rooms unoccupied and unused for most of the year. To pilot this program, there will be a limited number of services offered, but included are the most popular, including breast augmentation, revisions and lifts, tummy tucks, and liposuctions of desired areas. Hospitalization will be required for 1 to 2 days following the procedure to provide adequate care and education. Qualified and experienced nurses will also oversee the care of these patients under the direction of the physician and surgeons with patient ratio of 4 to 1. A 3-year plan was developed to project potential patient census and revenue. During the first year, renovation of the 8 rooms on the overflow unit will be completed. This will take about 3 to 4 months to complete, but once that is completed, the initial patient volume is expected to be 2 to 6 patients per week for the remainder of the year. During the second year, volume is expected to increase to 8 to 10 patients per week. By this year, evaluation of the surgeries will be done by the board and physicians to discuss if there is the potential for additional plastic surgery services to be provided, as well as hiring additional staff due to the increase in census. In the third year, volume will be expected to reach 10 to 16 patients each week, and further evaluation will be done to determine if renovation of additional patient rooms can be completed for this higher census of patients, as well as reviewing additional plastic surgery services that can be discussed and finalized for the next year. There are numerous strengths associated with this plan, including benefits for the patient. The Cleveland Clinic stated that patients who receive plastic surgery have a better quality of life, increased self-esteem and body image, improved safety with issues that impede mobility, and pain relief. Also, patient satisfaction is higher with the completion of desired services and outcomes. Strong relationships are fostered within this unit as staff are required to work closely together to care for these specialized patients. There is also the potential for growth into other plastic surgery services beyond women's services, as this specialty is such a popular elective procedure and it goes to men and women. With any new plan, there are some weaknesses and threats to success. Due to the elective nature of these services, insurance does not always cover the procedures. Therefore, patients are paying out of pocket, and the hospital does not always receive reimbursement from insurance or government agencies for these services. And because of the elective nature, there could be the potential for low surgical volumes at certain times of the year, or if surgeons do not continuously have new clientele. Lastly, there are numerous facilities in the Houston area that provide services like this, so it makes competition very high amongst surgeons and facilities. Moving on to the marketing plan for this project, after completing an analysis, it was discovered in 2023 by the American Society of Plastic Surgeons that 1.6 million cosmetic surgeries were performed, making the argument for the development of this unit very strong. There's only one other facility that offers plastic surgery in the immediate area next to HCA Northwest. The next closest facility is at least 15 miles away, if not more. As mentioned, the population of Houston is steadily increasing each year, and over half the population are female, making this unit a very strong candidate for having some of those females have those services completed. The HCA marketing will focus on several promoted activities for this project. There will be advertisements to recruit the desired nursing and physician staff, and referral bonuses and hiring bonus will be promoted to attract experienced and desired nursing staff. The Gulf Coast Division website will advertise about these new services along with HCA Northwest's website, and it will be heavily promoted to gain traction with those women who desire these services. Surgeons will also be provided with HCA materials that they are able to distribute in their offices or clinics. For the responsible parties, the staff will be hired 6 months prior to the start of the renovation of the unit, and during the renovation, there will be that time for the staff to be properly trained on policies and procedures for the facility and the surgeon's preferences. HCA Gulf Coast Division will begin to distribute the advertising materials in the 6 months leading up to the renovation, so time is allowed for patients to be established. The targeted measures include individuals interested in women's plastic surgery, and the amount of surgeries per quarter will be evaluated. The success of the new services will be dependent upon finances, public opinion, and surgical outcomes. Financial results and surgical outcomes will be evaluated on a regular basis to determine the impact of the unit and if there is a profit being made. Public opinion may also be one of the most important things, but also being complex to measure. But by the use of Press Ganey surveys and Google reviews, we will be able to determine if services are having a positive impact, and the awareness of the brand within the community is also positive. Following are the volume and revenue projections for the next 3 years. In 2025, the first 4 months are reserved for renovation of the unit, and the remainder of the year, 2 to 6 patients per week is expected. The peak volume for 2025 in November is around $30,000. In 2026, the average of patients is 8 to 10 per week. Revenue will climb to $48,640 for the month of October and November, and in 2027, it is projected to have at least 10 to 16 patients per week, with a peak revenue of around $77,000 to $78,000. Finally, even though plastic surgery may not be thought of as a necessity, there is a need and a demand for this service in the community. And the American Society of Plastic Surgeons reported in 2024 that even though we are living with a tighter budget these days, Americans continue to prioritize cosmetic procedures in their self-care routines. This leads to a great opportunity for HCA to increase profit in this area of the medical field. And even though HCA may benefit in a financial way, we also keep the patient at the center focus, and it allows for women to receive the surgeries that they desire. The board should approve this plan because HCA places the highest value in individuals, and they have identified this area of opportunity to serve those in the community for services that they desire. These are my references. Thank you.